Oh, look at that background. That's not
Hey,
fair. It's like really
thank you.
mesmerizing. It's better than, my brick wall back here.
I have this very similar brick wall behind me, so that's why I'm using the virtual
Oh,
background. But this came built in Zoom, so I didn't do anything,
oh, okay.
just selected from the options I had there. So
Yeah. Are you the type of
sure.
person who likes to just dive right down into stuff? Because I edit this all. None of it is live.
Sure. So I'm from Brazil, so I'm Brazilian, and I did my dental training and all my postgrad programs back in Brazil. So I'm not a U.S. licensed dentist. So my role here at the University of Oklahoma is to do teaching, service, and research. And I teach both dental students and dental hygienist students, and I teach them dental material science.
Awesome.
While I was back in Brazil in my graduate program, I worked on one of the foremost physics institutes of Brazil. That's why I have a very multidisciplinary background where I worked with lasers in dentistry, trying to figure out, how light could accelerate, dental bleaching protocols. Then from there, I started working with photodynamic therapy for the control of oral microorganisms. And then from there, I started up a company back in Brazil using a SBIR type of grant, which is for small business innovation research type, like the NIH has it, but back in Brazil. And then when I came back to the US, then I started working with the development of antibacterial dental materials, more specifically for restorative procedures, in particular dental adhesive resins, because we know how these, tooth looking like restorations, they tend to fail much more rapidly or faster as compared to a dental amalgam or even to, a ceramics or porcelain. And they're
That's why I
major.
reached out. That's why I reached out. Well, what cued me into all of this is 5 years ago, I had a patient that was frustrated. Now he had bite issues, sleep apnea, that kind of thing that were causing some deterioration. But essentially he said to me, I'm tired. I'm spending a lot of money and they really don't make fillings like they used to. And I said, you actually are right. I said, there are things about metal fillings that don't attract bacteria. I said, I don't even have a resource for that, but I know that's true. And although dental materials have evolved and like the particles that make them up are smaller and they're closely knit, they still, in a lot of cases, don't seem to work as well. They seem to get decay faster. I said, so
Absolutely.
you're not wrong about that. There's other things that you have going on, but that was part of
Yes.
his care was to figure out the why.
Absolutely. Your patient, you both are completely correct. What happens is that, dental amalgams, for example, they tend to corrode over time. And the corrosion products, they actually fill it up the interface between the filling material and the tooth structure. And in addition to that, because, amalgam contains silver and zinc and copper and other metals, then what happens is that those corrosion products, they leach out and they end up killing bacteria.
Yeah.
And because the surface polishing is much better for a metal as compared to a polymer material, then what ends up happening is that not only you have a material that doesn't upregulate the growth of bacteria, but also the surface smoothness is maintained in a much longer time span. And so when you look into dental adhesives and resin composites, what happens is that, they suffer some sorts of biodegradation because in saliva, we have enzymes called esterases. And these esterases, they tend to break a molecule inside of the polymer that are bonded by esters. And then these esters linkages, what happens is that when these materials break because of these biodegradation or hydrolysis, so water in saliva breaking the material, they end up leaching, byproducts like HBPP that allows for more bacteria to grow.
Right.
And in addition to that, the biofilms, they change from a healthy state into a disease-associated state. So not only are materials, they fail because of technological limitations, but also what happens is that we are selecting bacteria that are more Caries producing in nature.
Right.
And because these polymers, they tend to shrink during the polymerization reaction, from the liquid to a solid state, what happens at the interface is that you have areas where you don't have a complete feeling of that interface. And because the dental adhesive resin serves as a semi-permeable membrane, then bacteria is allowed to penetrate and form biofilms. And that leads to the major cause of failure of resin composites, which is the secondary caries because of secondary biofilms.
We're talking about that space when you place a composite, hit it with a light, it shrinks just a little bit. How much space are we talking about? Can you even sense that when you're flossing, or is it just something that it's
no, because so think about a class 1 restoration, right? So in a class 1 restoration at the occlusal surface, you have the restoration surrounded by sound tissue, right? Yeah. So that's not exposed per se entirely to the oral environment, but the outermost surface at the occlusal area is exposed. But when you look, if you could cut the tooth in half and you look into the internal area of it, what happens is that the polymer tends to shrink outside from the tooth structure. It tends to debond.
Right.
So depending on the cavity configuration or the C factor, as you may remember, then what happens is that contraction tends to be much higher. And that debonding and the incomplete enveloping of the collagen fibrils during the restorative technique allows for a hybrid layer that is not durable and is going to fail because you have the perfect storm. You have, cyclic forces being applied to it. Mm-hmm. You have bacteria, saliva, esterases, all at the same time. And yet you have collagen fibrils that are exposed to water and they degrade. So this allows for the formation of cracks and propagation of cracks within the hybrid layer. And that leads to the critical failure of that material. So when you put all of that in comparison to, a dental amalgam, then it kind of makes sense that we're making a bad choice going for.
It makes me sad for all the composites that have been placed and failed. So yes. I can see why, and that's why I'm so excited about it, why people like you are so passionate about creating more affordable but more effective long-term materials.
Yes.
Because that's
and so
for everyone.
So that was the problem that we were trying to tackle. How can we make our materials better? So we started looking at the literature and we found a gap that, materials nowadays, for the most part, they cannot exert antibacterial properties. They might have initial antibacterial properties because some of them, like glass ionomer cements, they release fluoride.
Like fluoride,
But fluoride it only acts in contact. So if you don't have the bacteria in contact with that fluoride ion, then what happens is that it doesn't have any activity against it. And because of salivary clearance, the initial burst of fluoride cannot be maintained. And the reality is that even if you use a mouthwash with a very high content of fluoride, you cannot recharge efficiently the material. So we thought, how can we make materials better? So we started looking at the development of these nanoparticles that we work with. Although when the article that you looked at talks about the utilization of neutron scattering to understand how the materials are actually well attached to the tooth structure.
Yeah, so let me stop you for just a second, because that's what I was like. I read this little thing. I'm like, well, you can't stop there. Like, when you're talking about using a high flux isotope reactor, I mean, how do you get a pass to be able to do that? And so I'm going to challenge you. I won't even say let's have you talk to your 13-year-old self. Because you're probably well beyond me at 13. I would say, if you're 10 years old, explain to me how this neutron scattering happens so that you can study dental materials and tooth structure. Like,
sure.
Because if I can't visualize it, I just don't even, it's hard for me to even understand what a nanoparticle is, even though I know the numbers on it.
Sure. So, so the high flux isotope reactor basically is a type of radiation, right?
Mm-hmm.
Like light.
Yeah.
But because neutrons, they don't contain any sort of mass or electrical charges, so it's neutral. That's why neutrons, right?
I'm going to have to put up a visual of like your protons, electrons, and your neutrons.
Yes.
Just to remind everybody, okay, we're going back a ways.
Yes, but because neutrons, they do not carry any mass inside of them or electrical charges, they can penetrate very efficiently through some types of materials. So like if you think about X-rays, they can penetrate, soft tissues, yep. And they are somewhat scattered by, hard tissues like bone. That's why we can see bone and you can see a fracture really well. Okay. But with neutron scattering, not only the radiation has a much shorter wavelength, right, that allows for a very efficient penetration, but also because it doesn't have any mass associated with it or electrical charges, it can go ahead and penetrate and go through all of it. And the scattering can be measured. So when, the neutron comes and gets in touch with an atom and gets reflected or scattered, we can actually collect that scattering and we can measure the angles. And by doing that, we can render into that three-dimensional image that you saw.
Yeah.
Of course, those images that you have seen, those are just the initial rendering, because the idea is to be able to go to a subatomic level so that we can have a resolution that can show us layers of atoms and how well the material can actually be bonded to the tooth structure. So that would be a sub-nanometric level. As of now, the current technologies do not allow us to see the interface in that such a high level, with that high resolution. So the idea is that if we can understand the degradation processes that occur right after the dentist places the restoration, then maybe we can understand how can we mitigate and how materials must be developed so that we don't incur to the same issues as we're incurring right now. So not only our materials, they have to be lasting longer and yet be very polishable and very aesthetic,
to be able to
but also they need to be antibacterial and they should be bioactive, meaning that they should be able to precipitate hydroxyapatite, which is the inorganic component of the tooth structure, on those areas where the polymer shrunk and allowed for an empty space. So in other words, what we're trying to do in the long term is a type of tissue engineering of the adhesive interface. So that imagine that you place the tooth filling, right? You place the restorative system, adhesive resin and filling material. And that particular material transitions into a completely mineralized structure after a few years that is placed. So not only you not have to change that, but you're growing tissue.
That's
exactly
amazing. It's amazing. It seems so.
So that's the idea behind the whole project.
Yeah.
If we're ever gonna get that far, I'm not sure, because there's so much that we still have to resolve, trying to make our current materials better for today's dentistry. It's like we're trying to get from the Milky Way to Andromeda, which is the nearest galaxy.
Yeah,
but that's still light.
It seems like the parallel, like, okay, we've got some, we're going to grow a tooth in a socket where we just had to extract a tooth. I mean, that seems like it could happen at some point. We've got stem cell research, and so it seems a lot in line, like it.
And it's happening, but the problem is that once you actually place the tooth structure that was grown, it's not being recognized as something from that patient. So there's still gaps that we need to overcome.
Yeah.
So the whole idea behind this project was, okay, can we make it better? And if yes, like we're being able to prove, in our publications, then can we even take to the next level, which is having a material that can precipitate tooth structure over time as it degrades, so that you don't have to deal with changing the material ever again, because the material turns into tooth structure. So that would be something very nice. But from the economic standpoint, a lot of manufacturers might be against it because we're taking out of a huge market share.
Well, that's like when you can run a car but via water. People don't really want that to come to market. So kind of along the same lines. That is so interesting. I appreciate you taking the time and getting me past like this little article. I was like, I gotta know more about this. Very, very interesting. So if let's say you did find the right mix of materials, because I was reading, adding metal oxide nanoparticles to these adhesives. Like if you were part of that, could you maybe throw your name in there for the actual material? Could it be named someone after you, or how many people do you have to share this with?
So let me tell you, I am the lead inventor of this, and I am the principal investigator in this research line. So this is something that I brought because I saw the gap. Of course, I do have, very important collaborators from the national labs that I work with, not only Oak Ridge National Lab, but now at Los Alamos National Lab also. And here back home, I have, my former mentor that now is the head of my division, also has played a huge role in the development of this. So it's not that I done or, was able to get this far being a dentist, because you can imagine that just to learn how to make the nanoparticles, it was very hard on me. So that's why we have a organic chemist. We have people that understand about these neutrons. We have people that understand about scanning electron microscopy, transmission electron microscopy. And then as I've been taught how to do this, then I'm becoming more and more versed. So not only these nanoparticles are being tested for, dental purposes, but now we're testing for antibacterial coatings and paintings, So imagine that in a hospital settings.
I'm familiar with Elementa, the silver nanoparticles in a rinse, and that's one of the products that I also thought of when it seems like the nanoparticle technology is it's up and coming, and it's really exciting.
Oh yeah, and there's a company which I cannot disclose, right? But they're testing our nanoparticles for the fabrication of paintings, antibacterial paintings, and coatings for hospitals to decrease cross-contamination. So one of the major, sources of contamination in a hospital setting is the toilet. Mm-hmm. So C. difficile, Clostridium difficile, is a bacteria capable of forming biofilms in water. So a patient that is contaminated and makes number 2 on the toilet, that bacterial load takes at least 24 flushes to decrease by 10%.
Whoa.
And they can become airborne.
Oh, a lot of people get sick in the hospital too.
Yes. And now we're also doing some masks for the COVID with the long-term self-sterilizing property using nanoparticles and light, so that, the healthcare workers do not have to change their N95 or the P95 respirators as they are working with patients. Because imagine, it takes about 89 million masks per month for the COVID-19 response. So if we can do something in that line, we can also help society a lot. So there's a bunch of things that we're doing as a group. Like I said, I am the principal investigator and the lead inventor. If you Google my name, you're going to be able to see not only my publications, but the patents that we have filed. And so there are US companies that are, you know, looking into using into the dental materials realm, but also into the secondary applications on the engineering and healthcare fields.
So what you're saying is you're pretty much a badass. And I'm glad I got to talk to you today. Thank you so much. I would love to pick your brain again sometime. Really interesting stuff. I know on a, you know, from a clinical perspective, I didn't get to really like delve into that much more than, you know, like telling patients to just applications, processes and stuff like that. So, and working from home now, I've got a little more time to explore and share it with other people. So I appreciate your time so much.
You're very much welcome anytime.
If you guys have any questions, you can leave them in the comments below. Make sure if you like this content, subscribe, give us a little thumbs up.